Chapter 14, Mental Disorders. Wellness and mental illness, of course, are two opposing things. Mental disorders can be caused by a number of things, including heredity, congenital things, things that were there from birth, accident, trauma, drug toxicity, stress, chemical imbalances in the brain, and its neurotransmitters are also considered possible causes. And the specific cause of mental illness can be, in many cases, not clear. Mental wellness is the capacity to cope and adjust to the ongoing stresses of everyday life in a reasonable manner. Mental illness is the inability to cope with stress that would be day to day living in society. Psychological pain is real and intense and can affect the physical health of the person. Um, Certain disorders in thinking, perceiving, and behaving can be have clusters of signs and symptoms. Mental wellness and mental illness are defined according to a reference called Diagnostic Statistical Manual of Mental Disorders, 5th edition. It's published by the American Psychiatric Association. So, this is where all of the points are included together to indicate a specific diagnosis for a patient. Number of classifications of mental disorders. It can be congenital, can be hereditary or genetic. It can be maladaptive disorders, phobias, anxiety, depression, addiction, and psychotic. Now, psychosis is another term that's used considerably. It's a symptom of a mental disorder that may indicate a more severe disorder. Um, where the person loses touch with reality. So that's a little different than saying psychotic. They may have hallucinations, irrational thoughts, may have regression, uh, they may have delusions. So there's a number of factors that goes into that. Modern therapeutic approaches of treatment include control of symptoms with medications, and we looked at some of these in previous semester with pharmacology, but the classes are antipsychotics, antidepressants, anti-anxiety agents, central nervous system stimulants, and mood stabilizing medications. In addition to that, sometimes hospitalization may be required in acute situations. Psychotherapy or group therapy may be used to help stabilize and treat the patient. Therapists that work with children often use play therapy to assess and treat patients, helping the child to cope with the situation, the stress, and the trauma of whatever is in their history. They can't verbalize their thoughts and their feelings, so play therapy sometimes is a nonverbal way for them to communicate. You may also see the non-threatening atmosphere for children uh, in this type of approach where you wouldn't need regular clinical approaches. If they've been exposed to abuse, then the therapist wants a non-threatening way of working with them, and this is often the way that they do that. Um, Intellectual development disorder is a group of conditions, but not necessarily any particular disease. It is related to developmental disability. Factors that interfere with their developmental process, uh, and these are the causes and the changes in the intellectual skills and the adapting ability. Usually comes in several different areas, including social and interpersonal, self-care, communication, health and safety. General intellectual functioning is below average in these patients. They have noticeable defects in their behavior and mannerisms. Um, Usually there's these are not evident until the child goes to school and is school age. Factors that predispose for intellectual development disorder are heredity. Again, that's the genetic or chromosomal abnormalities that result. Early change in or changes in the embryonic development, things like Down syndrome and toxin exposures. Um, Prenatal and perinatal and postnatal conditions, so things that happen before, during, and after delivery, such as prematurity, hypoxia, viral infections, and trauma, and general medical conditions, infection. IQ measurements are often one of the things that's talked about in intelligence level, but it's only one factor that they look at. Um, and there's errors that could happen in testing that gives a borderline score. Um, so um, they are a part of the process, but not exclusively based upon that. So this is just example would be the Stanford Binet test, which shows these different levels and different numbers that relate to certain inabilities. Diagnosis of these are below average intellectual functioning, limitations in at least two of communication, home living, self care, social interpersonal skills, and that's interaction with others, self direction, and health and safety. There's not a cure for this, but they can be trained in some cases and educated to do certain tasks on various levels. But the underlying cause of all these needs to be treated also. Those with mild to moderate developmental problems can function in society reasonably well. Those with severe functions may have to live in institutional settings with daily caregiving.